Hello, this is subjective data for patient LA. Miss LA is a 50-year-old female with a history of heart attack on April 29, 2019. She's of French-Canadian ethnicity. She's been experiencing a persistent, dry, unproductive cough for the past 15 days. And she states her chief complaint as, I've been coughing and coughing for 2 weeks, and I feel a lump in my throat, and it's not going anywhere. History of present illness. So LA states that prior to 2 hours prior to clinic visit, she coughed continuously for 3 minutes. Coughing episodes occur throughout the day. They're spontaneous, and there's more coughing at night. Coughing episodes have not changed in duration or severity in the past 2 weeks, and she feels a lump in her throat, but she doesn't have any chest pain or lung pain. And coughing episodes last a duration of 1 minute to 5 minutes. They're interfering with her daily activities. So she doesn't feel any pain, just a lump in her throat and an annoying cough. An aggravating factor is that if she performs physical activity like riding a bike, the cough is worse. She has a coughing attack. And an alleviating factor, lozenges soothe it, drinking something hot soothes her cough as well. But the severity is she has to stop what she's doing, so it's quite severe. No other associated symptoms. Fever's not present. She did try lozenges, cough medicine, honey, and hot beverages. She states she's tried Buckley's cough syrup and Mucinex to loosen the lump in her throat, and it happened 2 years ago as well. Just spontaneous coughing, no other symptoms. It lasted for a month and a half, and no one in the household is experiencing the same symptoms. So, as I said, the cough began 2 weeks ago after her surgery. It started suddenly. It's been unproductive. Frequency is intermittent. So regarding her family history, her father has had 2 heart attacks, but her brothers and sisters have no heart issues. So she has no sputum, no hemoptysis noted, not a harsh and barking quality, no post-tussive emesis present, no sore throat, no nasal congestion, no earache, no headache, no myalgia, no seasonal allergies, no gastroesophageal reflux. And this is the first visit to the clinic regarding this concern of this patient. She takes, regarding medication, Reactin 5 milligrams once or twice a week because she's allergic to cats. And then she takes aspirin once a day, ramipril once a day, metoprolol 12.5 milligrams BID. So ramipril is 1 milligram once a day. Tricolor 60 milligrams BID. Astrovastin calcium 20 milligrams. Her heart attack, as I said, was April 29th. She had a stent put in May 2nd. Her blood pressure was normal. She recovered from surgery, had no cough symptoms, no infection. So she rarely goes to the doctor. She hasn't been to the hospital for 22 years. And since her son was born, she is slightly overweight, by about 20 pounds, and has no drug allergies. Just regarding her social history, she has 2 jobs. She works in healthcare as a nurse's aide and full-time, and a teaching assistant part-time. No history of drug use or alcohol use. She didn't travel recently. She doesn't have a dangerous hobby involving glue or chemical exposure. She does not have any pets or any rugs. So regarding the objective data, we did a physical exam. In general, she appears, her stated age, she's well nourished, she's alert and orientated ×3, and no apparent distress. Her vital signs are remarkable. Temperature is 36.6, respirations are 15, blood pressure is 110/68. Heart rate 72, oxygen is 97% on room air. She's 5'6" and weighs 155 pounds, so slightly elevated BMI. Her neck, no jugular vein distension, no other neck distended neck veins. Her respirations are normal chest excursion. Breath sounds are clear, they're equal bilaterally, no wheezes, no rhonchi, no rales. Accessory muscles, she's not using those. So regarding, she has no sneezing, no postnasal drip, no chest tightness, no tachypnea, and no orthopnea. She denies PND, hemoptysis. For her nose, no nasal congestion, no sinus pain, no nosebleed, no sneezing, mouth and throat. Negative for difficulty swallowing, hoarseness, mouth ulcers, sore throat. Her nares are patent bilaterally, her septum midline. Normal pink mucosa, no polyps, no discharge, nasal passages and sinuses, patent, and bilaterally, septum's midline. Her mouth, buccal mucosa is moist, positive gag reflex, oral pharynx, no signs of erythemia or ulceration, normal movement of soft palate, no postnasal drip noted. For her heart, regular rhythm without murmurs, cardiovascular, peripheral vascular denies lower extremity edema, no irregular heartbeats, no dizziness, no syncope, no cyanosis, no swelling or erythemia of skin. S1 and S2 are heard, no rubs, no murmurs, no gallops, no S3 or S4 noted, and she has a normal apical impulse. There's no peripheral edema or calf muscle pain. She doesn't have any, as I said, no history of respiratory problems, no frequent pneumonia, no history of frequent bronchitis to asthma as well. And as I may have mentioned, she's not a smoker, has never smoked, and is not exposed to secondhand smoke. This concludes the report. Thank you.